I believe survivors because when you come into the hospital, you are no different than somebody complaining of abdominal pain or chest pain. If you are a victim of a sexual assault, I believe what you're saying. And you need to know that when you do come in, you are going to be listened to. You are going to be heard, and you're going to be taken care of, both medically and emotionally. My name is Kelly Nelson-Sikos. I'm a registered nurse. I work for Allina Health Forensic Nursing Program and currently am the lead forensic nurse for Allina Health. So as a victim survivor, you can present to any hospital and tell them that you have been sexually assaulted. At that time, the hospital will page a forensic nurse. For Allina Health, we currently have 25 nurses that are either on call or in a catch call program. So when we are paged, we will arrive at the hospital typically within 1 hour of being paged to take care of that patient. So some of the questions that I'm frequently asked are, do I need to file a police report to be seen? And the answer is no. The forensic nurse will help you make a decision on whether you want to file a police report or not. We actually have a state law that happened in 2020 that allows us to collect evidence and assign a unique ID to that kit. And what that means for the victim survivor is we can collect evidence, we can put a unique ID, it's completely anonymous, and we store that kit for 30 months at the BCA. That allows the victim 30 months to make a decision on whether or not they want to file a police report. So you do not need to file a police report to be seen, and we'd be happy to help you make that decision and help you contact law enforcement if you so choose so. Another question I'm frequently asked is, are you going to tell my mom or dad or my parents what I tell you? And the answer to that is no. Everything you tell me is completely confidential. What I like to do at the end of an exam is say, what are you okay with your parents knowing, and what are you okay with them not knowing? And then, is it okay to bring your parents into the room with us and let's just have a conversation? Let them ask some questions, but I will only answer the questions that you feel comfortable with your parents knowing. Another question that I am asked is, so what does an exam look like? I don't know if I want an exam or not, but what actually happens in an exam? And we are nurses. We are nurses who have gone to special training to provide sexual assault or forensic services. So being a nurse, I take care of your medical needs. We do a head-to-toe assessment. You share with me what happened with the assault, and the reason for that is that I need to know what areas to look at for injury. I need to know where you may be hurt. So a head-to-toe exam, you share me what happened, collecting evidence if you so choose to. We treat for STDs, we treat for pregnancy prevention, we talk about HIV risks, hepatitis B risks, and all of those are factored into your medical care. But what's most important is you decide what you want done at this exam. We can do portions of the exam, we can do all of the exam, but this is your exam and I'm not going to force you to do anything you don't want to do. What I want you to know is that we are a community that takes care of our patients. So when you come in, you will not only see me, but we will also make sure that you are reached out and connected to an advocacy. Whether that means they present to the hospital or whether that means we have, in some sites, tele-advocacy, in which it's an iPad that we Skype an exam, and other times it's just communication that they'll contact you the next day. I also want you to know that you're in charge of this exam. Nobody's going to force you to do an exam. Nobody's going to make you do anything that you don't want to do. This should never be more painful to you than coming in than if you hadn't come in. So please know that when you come in, your wishes are going to be respected and you're going to be listened to. I believe victim survivors because we know that sexual assault occurs far more than what we see in the hospital. And we know that people don't come in because sometimes they're fearful that people are going to judge them or they're not going to believe them. But you need to know that I believe you. We believe you. And we want to support and we want to help you and take care of you.